Yes, sir. So give me the sign. Good evening and welcome to the Sarasota Memorial Hospital Candidate Forum. I'm Sean Bartelt, President of the League of Women Voters of Sarasota County. I'd also like to introduce our chapter vice president and candidate forum chair, Rhonda Peters. Rhonda, here she is. Before we begin this evening's program, please rise and join in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The League of Women Voters is a nonpartisan organization that encourages informed and active participation in government. The views expressed are those of the candidates today, not the League, and this forum is not an endorsement of any candidate. The League does not support or oppose political candidates or parties. Invited to tonight's candidate forum are candidates whose names will appear on the Republican August primary ballot for the hospital board for at-large seats 1, 2, and 3, as well as Central District Seat 1. As Florida is a closed primary state, only registered Republicans can vote for candidates on the Republican primary ballot. However, all registered Republicans can vote for all hospital board candidates for all open seats and districts. Voters must be registered as a Republican at least 29 days before the primary election to vote with the Republican primary ballot. And I recommend that everybody check their registration status, and if you're going to be out of town, make sure you're signed up for vote by mail. Winners of the hospital board Republican primary election will face all other hospital board candidates on the general election ballot coming up in November. The Sarasota League plans to have a candidate forum that includes all hospital board candidates whose names appear on the hospital November general election ballot. That forum, which will include Republicans, Democrats, and those with no party affiliation, will be held after the primary election. Let's get started by introducing this evening's moderator, Carol Hartz, PhD, past president of the Sarasota League and moderator for multiple league forums in the past. Carol, thank you.
Thank you. Hello and welcome to the Republican Primary Hospital Board Candidate Forum. I'm Carol Hartz, tonight's moderator. The format for this evening's forum will be: candidates have 1.5 minutes to reply to questions and to make concluding remarks. All questions will be asked of all candidates. The order in which candidates answer questions will be rotated with each question. Candidates are requested to answer the question that was asked. No time will be given for rebuttal. Candidates may discuss their opponent's policy positions, but may not make personal remarks regarding other candidates. Our timer will hold up a yellow block when 10 seconds remain and a red block when no time remains. Candidates must stop talking when the red block is held up. Timers, please hold up the yellow block indicating 10 seconds remain. Candidates, you can all see that. And now the red block to signal that time is up. Just for completeness, I also have a bell to signal that speaking time has ended. We ask the audience not to applaud and to be silent until after closing remarks. We ask that no literature be circulated during the forum. League guidelines prohibit any recording of this forum. The League will record this event, which can be streamed from our website and from YouTube. Our guidelines prohibit anyone from using any portion of this recording for any purpose. The League would appreciate your turning cell phones and any recording devices off now. Thank you. I'd like to introduce Republican Hospital Board candidates by seat now. Hospital Board at Large, Seat 1, Sharon Wetzler DePeters. Tamsin Rosenwasser declined our invitation. Hospital Board at Large, Seat 2, Kevin Cooper. Dr. Stephen Gafanti declined our invitation. Our sound system supports 3 candidate microphones. Ms. DePeters and Mr. Cooper, please share a microphone. Hospital Board at Large, Seat 3, Pam Beitlick, Mary Flynn O'Neill. Ms. Beitlick and Mrs. O'Neill, please share a microphone. Hospital Board Central District, Seat 1, Sarah Lodge, Tanya Marie Paris. Ms. Lodge and Ms. Paris, please share a microphones. Candidates, thank you for participating in our forum. Let's give all the candidates a round of applause now. Okay. Our first question, please introduce yourself, describe your education and experience related to this position, and explain why you are the best candidate for this position. Now, candidates, this is meant to be an introduction of you and your background and why you are the best. We'll have some time for policy questions later, but please tell us about us. And the first candidate that we'll call on is Mr. Peters, please.
Okay, thank you so much. Can you hear me with this? Okay. Good evening, and thank you for having us. I'm Sharon Wetzler DePeters, 3 names. The husband would not take my professional name, so I had to take his. Unfortunately, I got stuck with the 3 names, so you can't forget that. You'll see 3 names there. So, born, raised, educated in Buffalo, New York. Anybody from Buffalo? Oh, one maybe. Oh, God. Anyway, it was good while I was young, but not so much anymore. So I went to University of Buffalo. I have 4 degrees after my name. They're all in nursing. And so I'm married. I have 2 children. And all those nursing degrees culminated over 45 years, RN, nurse practitioner. So I was recruited as a commissioned officer into the Air Force, United States Air Force Nurse Corps. And I was actually there for 21 years and took care of a lot of fellows from Iraq and Afghanistan in those years. I moved to Florida in 1999 and became an associate professor of nursing at SCF for 15 years. I'm not a politician, so why would you want to elect me? Because I've been on the board for 8 years, and I got the red paper.
Thank you, Mr. Peters. Mr. Cooper.
Yeah, so my wife Misty and I moved here 16 years ago to Sarasota County. Before that, I spent 6 years in the military. I'm a combat veteran. I served in Operation Iraqi Freedom, stationed just outside of Fallujah as a convoy security operator, and have been serving the country here since I was 18. We have 2 children, both of which were born at Sarasota Memorial Hospital, and have a big affinity for the organization. And really personally and professionally, since I've gotten here, the community has entrusted me with its most important organizational assets. I was executive director of the Siesta Key Chamber of Commerce. I was president and CEO of the Sarasota Chamber of Commerce, and I'm in my 6th year as vice president at Moat Marine Laboratory and Aquarium. But also personally, I'm a serial volunteer. I've served on boards with State College of Florida, the Bay, 40 Carrots Family Center, Sarasota Tiger Bay Club, the Lakewood Ranch Business Alliance, and my home church, Hope City Church. But I also think it's important for you to know the character of people who are running for office, and I think a lot can be said about the character of someone and the people who surround them and come alongside them. I was recently appointed by Governor Ron DeSantis to chair the Early Learning Coalition here in Sarasota County. So I'm entrusted by him to further the state's interest in the provision of early learning and family care for our families that are most vulnerable here in Sarasota County. I have also been endorsed by Sarasota County Sheriff Kurt Hoffman and the firefighters and paramedics here in Sarasota County. And if anybody knows anything about community service, it's Sarasota County's finest and bravest. And so I count it a blessing to have them alongside me and look to have you as well.
Thank you. Ms. Beitlich.
Yes, my name is Pam Beitlich, and I am not a newcomer to Sarasota. I have been here for over 43 years. I am married for almost 40, have 3 children that were born in Sarasota Memorial Hospital, all attended public schools and graduated from Florida State and UF. I have very deep roots in this community, and let me tell you why I think I'm the best candidate for running for seat number 3 at large. I'm a registered nurse. I'm an advanced registered nurse practitioner. But more than that, I have a master's degree in nursing and a doctorate in healthcare systems leadership. Key word is leadership. Although I started at the bedside as a registered nurse, I've been in leadership roles for over the last 25, 30 years. I worked at Sarasota Memorial, just recently retired after 43 years there as the Executive Director of Women and Children's Services. I was in charge of over a $42 million revenue budget, 300 FTEs, had 10 leaders directly reporting to me. We had 4,500 babies delivered last year.
Amen.
And I will tell you, my commitment to all of that, making all of that work is incredibly high, let's put it that way. I'm extremely committed to doing what's right for the patient, honoring the physician-patient relationship. At the end of the day, I know how to run a great hospital. I have the background, education, and expertise to do so. Thank you very much.
Thank you. Mrs. O'Neill.
Can you hear me? Okay. Yep. Thank you. I am a Mary O'Neill, and I am the Executive Director of America's Future. It is a 501c3 right now. I've been here for 4 years. I'm a mother of 3 grown children, 4 grandchildren, 3 15-year-olds. I have an MBA. I have an environmental science degree. My major is environmental psychology. I have worked for a huge CPA firm. I am been in 40 years of nonprofit and businesses, for-profit. I have a finance, accounting, compliance, and auditing. I am about sustainability. I'm about the community. I'm about the taxpayers. I'm about this community, very in particular. I have worked in the hospice, and my ministry was consolation, taking care of before and after care of patients dying. I am an advocate for children. I have a certification in ARC, which is Associates of Recovery of Children. I run a nationwide incentive across the nation in every state now for child exploitation and trafficking, and we are doing a lot of work in child trafficking. I'm very concerned about the hospitals, and I want to be voted in as a board member because I can do big work for this hospital. I am very concerned about the sustainability of the hospitals coming in the future. Thank you. Vote for me. At large, seat 1.
Thank you. Ms. Lodge.
Oh, yes, I'll get yours.
Thank you. My name is Sarah Lodge. I'm running for re-election of the hospital board. I currently am the chair of the public hospital board that serves you. My family, my husband and I moved here immediately after, or right after getting married. We have 3 children that were born here at Sarasota Memorial. We both own businesses. My professional career is I am a certified financial planner and a first vice president with RBC Wealth Management. I have a degree in health science from the University of Florida. And I think that those 2 things combined are very unique for this hospital as being able to strategically look at where our community needs growth and be able to make fiscal decisions that are large. We are a $2 billion hospital and 12,000 employees. That's not taken lightly, and patient care is huge. So I've experienced that since May of 2020, and I ask for your vote on 8/20 for re-election.
Thank you. Ms. Paris?
Hello everyone, I'm Tanya Perus, and I am a proud mother of 3 boys, ages 22, 10, and 8. We moved here right before COVID happened, so February 1st of 2020, and we moved here for the safety purposes. We were living very close to Atlanta, Georgia, and safety became a very big issue for us. So we wanted a place that was safe for our kids and to actually have some roots in the community. So I look at Sarasota like it's the place where I'm going to rest my soul, and I hope my kids have my grandbabies here. I have over 20 plus years of business experience. I was the vice president of product development, business development for a couple companies. I have worked in strategic lines of businesses to advance products and initiatives. I have the business education behind me, but what most is behind my soul is healthcare. I was an EMT in Georgia. I did experience that life. That is very fun, but I was a little thing and I hurt my back and had to hang my hat up, unfortunately, for that. But overall, my biggest focus has been recently the We the People Health and Wellness Center, because I found a need where people were looking for providers in primary care that doctors would, 10 seconds, doctors would listen to them and treat them with respect and give them one-on-one patient care. So I do put that, okay, and I'm gonna stop, but thank you everyone, and I'm Tanya Paris.
Get the red card, it's hard.
Thank you. Question 2. What do you consider the greatest strength of Sarasota Memorial Hospital, SMH? If elected, how do you propose to maintain or bolster this strength? And for question 2, I'll begin with Mr. Cooper.
Sure, I think, so I think the greatest strength is that it's a community nonprofit and a hospital. And I think what we've seen over the past at least 16 years since I've been here is 2 things: the geographic growth of the hospital and the service growth of the hospital. So when you look at the main campus, what we've been able to do in behavioral health, cancer services, and everything that's growing around there is really important, but it's also the geographic service. If we're going to be a community hospital, we have to have equitable access to the community-wide. So we've grown into Venice, we continue to expand here, and I think one of the most important things we're going to be doing is growing our hospital in Northport at the Sumter campus. So the things that we're able to do geographically and service-based are the most important strength that we have, and what I will bring to it is a commitment to make sure that we open that Northport campus by 2028, I think, which is projected right now. And because to me, one of the most important things, I don't want people having emergencies and having to drive an hour in traffic to get to the emergency room. It's just not right. If we're a community hospital, we need to have community-wide access.
Thank you. Mr. Peters.
Yes. So, the greatest strength of the hospital is to take care of patients, provide quality care, which they've done for almost 100 years. They're having their anniversary pretty soon. I've been with them for 8 years and on the board, and I've seen the growth. I've lived in Nokomis, and I've seen the growth over there. And we need access to health care. Being a nurse practitioner and an RN all my life, I want good quality of care. I want best-in-class doctors, nurses, staff, and we have that, and they've proven it over the 100 years. And with me on the board for 8 years and affiliated with the hospital for 25 years, I see them. I'm an advocate for the patients. I'm actually on the medical staff there with my patients because I'm a nurse practitioner with a private cardiologist. And so I see what they do. I've educated many of the nurses over there at State College of Florida, and it's our pride and joy to be able to take care of patients and to make accessibility there for you, all through the county, wherever you live, to be able to get good health care with good, best-in-class doctors, nurses, and staff. And I got the yellow card.
Thank you. Mrs. O'Neill.
My concern and my abilities would be to make sure that the healthcare stays at high quality for the community. I'm more interested in taking care of the community and the sustainability for the taxpayers. We do have a great hospital, so the rewards and all the awards are there, and it's a world-renowned hospital. But I am a person that looks at the 60-foot view looking down, and in the coming future, we need to be sustainable financially, and we need to always take care of the community people and the taxpayers. So I want high-quality health care for the communities. I'm very I'm an advocate for the community and the health care, and financially, I can take apart a financial like nobody can. And I can find how to sustain a hospital, any business. So that's what I'm looking for. I'm looking for working with the community and making sure that they are represented. This is a public hospital. A board should be the wall of defense for the community. And that's what we need to do.
Thank you. Ms. Beitlich.
I think one of the greatest strengths that we have at this organization is not only being a public organization, a public institution, but the credentialed providers that we have on staff. We have almost 2,500 physicians and healthcare providers. We have roughly 3,500 nurses. Because I've been so involved with the recruitment and retention of providers, I can tell you how high our standards are to be on staff at SMH. I can assure you that not just anyone can be credentialed there. I can assure you that not just anyone can be hired as a nurse. So with those two pieces together, what I feel is the best part about being at this organization is this board really knowing its role. Our role is not to practice medicine. Our role is to make sure we provide you, the community, with the very best healthcare professionals we possibly can to recruit, get them here, the world's best physicians, and then make sure we have the best equipment, supplies, all the things that they need to really provide you with excellent care. I've asked many people, what is it that you like about this hospital? Well, I get there and I'm taken right into the ER, etc. I just want to say none of that happens by chance. It is a very complex, complicated system, and we have a very great team to be doing that. Thank you.
Thank you. Ms. Paris, before you begin, will you pronounce your name for me, please?
Oh boy, it just is whatever you want to say. My husband is from Poland, so he pronounces it Parus, so I say Paris.
Thank you.
And he says that's okay, so we're good with whatever.
Okay. Thank you. Please answer.
Yeah, I think our greatest strength is that we are a county-funded hospital. I think I want to, hit the nail on the head there. I've never been on board with privatization. I don't even know how that one started. That is absolutely not something that I support at all. The county aspect of it is an incredible strength that we have here to be able to change policy if we need to, or not, be behoved to some rich billionaire who owns our hospital and makes decisions for us. It's about the citizens, so I just want to spell that out. Yes, I do agree that we have wonderful physicians, staff, and we have all the roots to make this a beautiful hospital. But I do feel like the board should really focus more on helping out our patients. I've heard tons of stories about patients that have come to the hospital and have felt uninformed about the decision-making process along the way, and then have winded up with over $100,000 bills, and then been told they have to pay that money within 30 days. I've heard the stories. It's something that we can work on as a board, and I think needs to be addressed because we are a county-funded hospital. And then I think we just should be more involved with, I'm not saying that we need to be doctors up here, but we should be involved more with our medical committees that are part of the hospital. I think that the board has to make decisions, and they have to be well informed in order to make those decisions. So we should be more involved in those. And
Thank you. Ms. Lodge.
Good job.
Thank you. I think Pam said it great. One of our greatest strengths is that we are covering patient care on all levels. Excellent. Every month we sit down and we The board sits down and reviews privileges for the hospital, because not every doctor out there can be on our have privileges and be on our staff. And I think that's really important to know as a community member. This is your community hospital, so when you are sitting with your doctor, it's really important to understand where they can treat you. Just this week, I've had to deal with that several times, of getting people transported from other hospitals because the care isn't good. So we're very lucky to have a hospital at the level it is. Money Magazine just ranked us, I think, 7th in the nation. You guys should be proud to live in a community that has that. People move here daily for that. Patient care is incredibly important to this board. We meet and discuss that all the time, go over, the quality of the care that we're given, and if there's any issues and that need to be addressed. We listen to the community and what's needed. So in 2016, this community said that we needed to have more oncology care. And so we stepped up and built the oncology tower that is still continuing to grow. And we're able to do that because we're fiscally solvent. And I'll stop there and continue later.
Thank you. Okay. For all further questions, I'll use the abbreviation SMH to refer to Sarasota Memorial Hospital and Healthcare System. What do you consider the greatest opportunity for improvement within SMH? If elected, how would you propose resolving this issue? And Ms. Beitlich, if you'll start us off, please.
Well, let me start by saying that improvement is part of our daily life. It's in DNA, our DNA at SMH. And as I said, I was there 43 years. I was there for every CEO except the first one, Don Laurent. And I can just tell you that every single day we say, what can we do better? I think one of the biggest opportunities, not just for us, but on a national healthcare level, is really the fragmentation, if you will, of having several different physicians. You have a captain of the ship, if you will, but then you have other providers, and really doing a much better job every day. We can improve on making sure that that communication is there, that you're very informed, and you're right, Tanya, very informed of everything that's happening to you, the decisions that are being made, all the way down to your financial bill. Absolutely, we can still do much better with all of that. Thank you.
Mrs. O'Neill.
I would look into the amounts that taxpayers pay. I would find out and be transparent to the taxpayers about where their money's going, what it's being used for at the hospital. I get this question all the time, and I have looked at these documents. I have looked very intricately into how the operation works. I would also take the resident discount, and the cost of the procedures and the amounts of money that we are charged are outrageous. So I would look into the costs for the residents. I also would look into the way the financial department is running their billing, and many people are getting bills and being put into collections. That is a very big piece that we need to take care of in this community. It's got to be sustainable for the people. And, healthcare, of course we want healthcare quality to be high. There's also something else I want to say. There are doctors that are working outside as a concierge, and many people go to concierge doctors. I do, in fact. I had a doctor help me outside, and I want to be able to take doctors that are not allowed to go into that hospital to see their patients, be able to go in and do that. There are doctors that need to go in there and see their patients, and right now some are not allowed, so that's something that I would look at.
Thank you. Ms. Lodge.
What can we do better? There's a number of things, and I think that on a daily basis, as Pam said, we are constantly asking what we can do better. I do want to address your comment on the concierge doctors, because I think this, and I said it previously, concierge doctors, if they meet our criteria, are welcome in our hospital. We have many of them we have one sitting in the room who has privileges at our hospital. They have to meet our standards. And the reason for that is because whether you're a concierge doctor or not, we still want to make sure the patients in our hospital are getting the best care that they can get. And that's a priority. To go back to what we can do better, I think in order to grow at the fast pace that this community is growing at, we constantly need to evaluate internally and externally of what needs to be done to keep up with your needs. Whether that's improving technology, looking at growth in Northport, which I know everybody down there is so excited to not have to drive an hour away. Those things are very important to this board, and we need to continue to do that on a daily basis, and we will. So,
Thank you. Ms. Peruse.
Yeah, thank you. Yeah, so I think some of the things that could be changed, I was just jotting down a bunch, so I want to make sure I hit the points. I feel that we obviously need to have more involvement from the community. I'm a big advocate of patient first and community participation. Some of those things would be like including workshops for the community to participate in. A lot of people in the community don't even know what goes on in the hospital. Some of them don't even know that it is coming out of their tax bill. So I think that there does need to be a drive to pull in the opinions of the community, especially about upcoming decisions, upcoming changes, policies, things like that. Most people do want to be involved, they just don't know how to do it and what's coming up. Obviously, that would involve more than once a month meeting with the hospital board. I think that should be standard of any board to meet at least twice a month at minimum. Billing is a huge issue to me. From what I've heard, that can crush someone's entire finance. That can kill somebody's life right there. I've seen how detrimental that is to be hit with $100,000 bill. That's outrageous. And then alternative solutions to different medications and procedures. I think that we need to introduce and welcome other doctors who have been using alternative solutions and treatments to maybe do some grand rounds at the hospital and get our staff familiar with that. All right.
Thank you. Mr. Cooper?
Sure. So I just want to make sure, my opinion is clear. The Sarasota Memorial Healthcare System is one of the best run healthcare systems in the state, if not the country. And that's based on the healthcare outcomes of the patients. But that doesn't mean we can rest on our laurels. We have competition in this community, and so we need to continue to grow. And one of the greatest opportunities we have, and we've talked about it a bit, is the expansion into Northport. But what comes with that is the opportunity to continue to attract the best and brightest medical minds in the country and around the world to come here and bring innovative solutions to emerging healthcare needs here. And so as we grow, the best part about that is that people want to come to Sarasota Memorial Healthcare System because we do have some of the best healthcare outcomes in the state and the country. And that's just not something you say. You can go on the website and you look at it. That's not just conjecture. And if you've ever been to Sarasota Memorial Healthcare System, you know about the healthcare options you receive and the better outcomes that you have. And so the opportunity for us is just to get better. And I think that's what it takes, a really good board and a good administrative oversight to make sure that we're continuing to push that forward and not get, hey, we're really good, look at all the awards we have. But as we grow, what I'm excited about is to continue to go out there in the medical community and bring fresh and new innovative ideas here to help us solve the most pressing healthcare needs that we have, because it simply can only get better. And we should be thankful for that, because the healthcare outcomes we have in this community are the biggest thing we should be focused on, but it's also the biggest opportunity we have to make sure it gets better.
Thank you. Mr. Peters?
Yes, so I know you all know that healthcare changes on a daily basis. You hear about it, you see it, and you feel it, and you're involved with it. And so I personally sit on many committees at the hospital. I'm on the floors every day. I have patients there, and with being on the board, I have other commitments there that I'm on. Sarasota Memorial does their interventions. They listen to people. They make the changes that are necessary. We're transparent. You can find any question you need to find on our websites. We listen to people. We created an app for people that got lost in the maze of our main campus in Sarasota. And I personally got lost in the maze one day and had to use that app, even though I'm there all the time. We've grown, and we've tried to accommodate people. Most of us have come here for the health care that Sarasota Memorial has provided. And with the change in healthcare on a daily basis, they're visionary. They listen. They protect the patients as any way they can. And we have our accolades. If you have 2 hours, I can sit and recite them for you. But it's all from patients. It's all from patients' care. And if there is a problem, we're open. We're open to listen to it. And we'll correct that and intervene. And I got the red card now.
Thank you. All right, our fourth question. What lessons, if any, do you feel were learned during the COVID pandemic? Question 4, Ms. Perus.
Oh, yes, it would be. What lessons were learned during the COVID pandemic from a board standpoint? Could you
Yes.
clarify? Well, I mean, Mr. Peters just called out that the board is willing to listen. I would have to agree in the beginning, but as a member of the community, I did raise a few alarms in front of the board, and I think that, you know, I brought a lot of people with me that had lost their loved ones at the hospital, and I would love to, nothing more than to move on from that as well, but, you know, how do you move on from that when you no longer have a spouse or a family member? So I think the board was willing to listen, but they didn't heed the advice of the public. So I think that's very, very important, and we do have to do something about that. Something still has to be done. I know that we'll probably get the feedback of the hospital did, in fact, do a report and went back through the statistics, et cetera. But I do know from what I've done in my prior career, you can make a statistic whatever you want it to say. So that is one of the things that I have a problem with. And I have, you know, I have it in my heart to continue to make sure that we do get some closure for the people who did lose their loved ones. And that looks different to everybody. So I do hope we can move forward on that at some point.
Thank you. Ms. Lodge.
Great, thank you. I think the hospital, I came on the board, just to clarify, of May of 2020, but you and I, like everybody else, was sitting back and listening to the news, and gosh, it was tough times. There's no doubt about that. I think the hospital did an excellent job, and the report that we did that Tanya is referencing was actually, we had an external person come in and do that report. It wasn't an internal investigation to review. It's 85 or 96 pages. It's on our website. You are welcome to read it all. We looked at 10 patients and how their care was, and then that came to us. One thing you have to keep in mind as a board member, we can't respond or give out patient information because of HIPAA laws. And so we hear you. We hear you as a community, and we talk internally because of HIPAA laws. We are also under Sunshine Law, so we can't meet externally to discuss these things. So yes, we welcome the community to come in. There were tears shed by board members, tears shed by staff, doctors, and we feel the pain of the community and the people that were lost. Nobody wanted to lose those, and you know, I think if you look at the report, you'll understand that we did 30% better than other hospitals in other areas to save the lives of those out there, which is excellent. So,
Thank you. Mr. Peters.
Well, I have walked, I forgot about this little thing. I have walked through the hospital during the COVID time, and I had tears in my eyes. I hugged the doctors, I hugged the nurses, I cried with them, and I tried.
give her the other one.
Is it going?
And I tried to.
It's red.
Oh, I got it back. All right, so I cried with them. I go way back during the HIV time when nurses were afraid to go in patients' rooms, and this is what I signed up for. And our nurses at Sarasota Memorial were the same way. I signed up for this, they said. I'm in there. I'm crying with my patients. This is something that was so drastic and such a heartbreaker that we were all in tears over it. But we did what science told us. We did our best. We took care of patients, and as the nurses and the doctors are trained to do. And we were visionary and prepared with supplies and equipment that we needed, so we weren't lacking anything. My heart goes out to all the patients and the staff during that time.
Thank you. Mr. Cooper.
Yeah, so I think the lessons we learned is that we did some things really well and we did some things not so well. And that's kind of what happens when you encounter something for the first time. You know, when I was a parent for the first time, I encountered some things I'd never encountered before, and I did some things well and some things not so well, and I continue that today with my children. But I think the question we need to look at is, how do we perform against our peers? And what happened different at SMH than Doctors Hospital, than Lee County Healthcare System, the Manatee County Healthcare Systems, than London, than Frankfurt, than around the world? I mean, this was a global pandemic. It wasn't an epidemic of the United States. It was a global pandemic. And I think that's what we need to look at is when you're thinking of juxtaposing Sarasota Memorial Healthcare System of how it performed during the pandemic is, what was it doing differently from other healthcare systems and how did that affect outcomes? And so when you look at our mortality rate based on our regional competition and national competition, we did very well. Our readmission rates, not so well. And we need to learn about that. And we talk about our guidance systems and our communication systems with families and loved ones. We know that that was a challenge for us, and we need to learn from that. We need to grow from that so we're better prepared for the next time, because I don't know that there was any hospital on the planet that was really fully prepared for this. But now we've learned, and now we're better prepared for if something like it comes in the future. But the likelihood of something exactly like this happening again is infinitesimal. It'll be something very different. But it depends on your measure of success. But I think I would ask that people look and juxtapose to what did Sarasota Memorial Hospital do differently than its other people around the world, and regionally and locally and nationally.
Thank you. And finally, Mrs. O'Neill.
And then you. I would keep government out of our face. I would keep government out of our lives. That's what I would do. That's why I want to keep this public hospital very intact. We need to find out what happened during COVID and put me in, and I will find out, and we will learn from that. But I will keep government out of this because it's going to come again. It's going to come again, believe me. And that's what I would do, and I would prepare. I know no hospital in this country was ready. This was forced. This pandemic was incredible and very emotional. But we do have to remember that all over this country there were loved ones that lost their lives, and it happened, and we can't have that happen again. Nothing can happen like that again. But the government had a lot to do with it, so that's my deal. I would keep government out of it. I would fight tooth and nail.
Thank you. Ms. Beitlich.
Yes, on top of everything that's already been said, just a couple of things. First of all, there is no way you will ever, in my opinion, keep government completely out of healthcare. First of all, your Medicare, so many things are controlled or paid for by the government. Secondly, healthcare, just like an airline, is highly regulated, and you want it to be, so that we're not just making things up as we go along. I see several healthcare providers in the room. It's there to protect us. I won't go into all of the things around COVID. That is something that, I will be honest, I've said it before, I don't wake up every single day worried about national politics. What I'm worried about is Sarasota Memorial, your local healthcare, what we do right here at this organization. I can assure you, having been there every single day, coming in every morning, you had healthcare providers coming in every day to take care of perfect strangers, people they've never met in their life, put their lives at risk. And yes, a few people have spoken out that we didn't do a great job. And I want to be really clear, I think that's really an absolute disgrace. We had so many things coming at us. This hospital is there to protect and keep you as safe as possible. I know that for sure. Thank you for the red card.
Thank you. Now we'll have a lightning round composed of questions that candidates can answer with yes or no.
Oh boy, these are the
Candidates, each of you has a paddle with yes or no on opposite sides. Please hold up your paddle now, just to tell me that you have your, okay, everybody's got their paddle? Thank you, you can put them down. There will be 3 lightning round questions. Our first lightning round question is, the SMH board recently opted not to endorse Florida Surgeon General Ladapo's guidance against COVID-19 vaccines. They instead approved a different motion reaffirming a commitment not to invade patients' relationships with their doctors. Do you support this decision? Please hold up your paddle with your answer facing the audience. Thank you. Informative. Our second lightning round question is, do you support maintaining SMH as a public hospital? Please hold up your paddle with your answer facing the audience. Thank you. Our final lightning round question is, do you support Medicaid expansion in Florida? Please hold up your paddle with your answer facing the audience.
Is there a?
It's not really our
Now
choice.
you can
It's
twirl.
not really our choice.
Yeah, I like that.
Very clever. I thought twirling was, you are welcome to twirl if you feel like there's not a yes or no answer to this question.
I like it.
You can either rotate your
not
paddle
a
or
board.
hold it up sideways. And this
exactly.
is,
You know,
It's
Do
not
you
up to the
support-
board to have that decision.
that's not my decision to make, really.
Exactly.
okay,
And so
all right, that's fair enough. I think we unanimously have decided to throw out this question, and I'm just fine with that.
Thank you.
All right.
Thank you.
Thank you. Okay. Now we'll go back to our 1.5-minute format for answers. What is your, and this is question 5, what is your definition of medical freedom as it relates to SMH? What changes would you recommend, if any, to comply with your definition? Everybody clear on the question? Should I repeat it?
2 questions. That's 2 questions.
Yes,
Go ahead.
so you have 45
Okay.
seconds for, or no, you have 1.5 minutes.
So just can you read it again?
Yeah.
Yes. What is your definition of medical freedom as it relates to SMH? And what changes would you recommend to comply with this definition if elected?
That's me first, right?
And there's an if
actually-
any in there.
I think it's actually me. Yeah.
Okay, and that's if any. What changes, if any, would you recommend? And so for question 5, Ms. Lodge, please.
Thank you. I think the definition of medical freedom is that you have the choice of your own body to make a decision of whether you want something or not, and what decision, whether it's dealing with cancer care or vaccines or just, do I want to take an antibiotic? And so knowing what your options are and then you having the freedom of choice to make that decision, which I am 100% for medical choice, which is, I think, very important, and that's why I voted against the motion, the Ladapo motion. I think the hospital does an excellent job at this. I think the doctors have informed consent with their patients, and it goes back to what I said before. Knowing who your doctor is, where they have privileges, if you align with what your doctor's beliefs are, that is your choice to have that relationship with the doctor. And so I'm strong advocate of knowing who your doctor is, doing your research before, and then making sure that you have the informed information to make your own choices.
Thank you. Ms. Peruz.
Yes, I would say that having a choice is medical freedom and no mandates. When you get down to mandating medicine has never been a one-size-fits-all, and not every patient deserves the same treatment, the same protocol, etc. And that kind of talks about what Mary had mentioned earlier, the government involvement in medical care. So the protocols is what medical freedom has, that's why we support medical freedom, because the protocols that were in place and still are in place in SMH, they're not a one size fits all, and people need different treatments, and some patients didn't want what was done to them, point blank. And then just having true informed consent. So being at, you could be rushed into the hospital at any moment, and your family is there as your advocate, and they need to know everything that's going on to be able to make a decision for you, or you yourself need to know everything that's going on in order to make a decision for you. That also falls under what I believe is medical freedom, and that would be within SMH hospital. But I think SMH did not support that. I know the employees did have a vaccine mandate. I've seen the emails from employees that stated they had a vaccine mandate. So I think that we have to make sure that that never happens again.
Thank you. Mr. Cooper.
Yeah, so I think it's pretty simple, is, medical freedom cuts both ways, right? Doctors should have the right to legally exercise their medical license the way they see fit to recommend treatment plans, and patients should have the right to accept those plans or reject them and seek a second opinion, and I think that exists today. That's why the term second opinion exists, and I've exercised that myself, to seek second opinions when I wasn't pleased with treatment plans that were afforded to me. And so I think any changes that need to be made are based in that, and I don't think that's my experience, is that's not been a problem. And so as long as, and the hospital has a process for discharge against medical advice. You can do that when the hospital says, hey, we don't think you should leave, you can still leave. And you fill out paperwork for that, and if that's not medical freedom, I don't know what is.
Thank you. Mr. Peters.
Yes. And so, yes, and I agree with Kevin. The definition of medical freedom for me is patient-doctor relationship. You have a right as a patient to change doctors, to get a second opinion, to do your research, and to decide whether or not that's good care and treatment for you. The doctors have the education behind them. They can provide you medical education and surgical intervention choices, but ultimately it is your choice, and you do have a right to change doctors, to get a second opinion, to do your research, and I've really never seen much of that happening at SMH in all the years I've been there. We provide them with some research, and we provide them with videos of what their surgery, open heart surgery, may look like. We do patient teaching very well, and with that teaching, patients have that right to decide, is this something I want, or do I want to investigate it a little bit more? And so I'm waiting for the yellow card to come up.
Thank you. Ms. Beitlich.
No problem. First of all, I need to really clarify, because again, I was there, I was working. We never had a vaccine mandate for employees. Never. And I want to repeat that. Never. No one was ever forced to have a vaccine or get fired. Again, that is something that we thought was very important as far as medical freedom for our employees. My definition of medical freedom is pretty simple. Just like everyone's been saying, you have the right to decide what you want for your own body. Everybody's different. Maybe you don't, as Sarah said, even want an antibiotic. I think that's your choice. It's your choice to do that. I also want to say, though, that we did make changes during COVID that at the beginning, and please go back with me and think about this. We had the CDC, the FDA, we had all these people coming at us. Again, I don't know what you do in the middle of a pandemic, but listen to what the science is telling you. You can say whatever you want, shake your head no for the government. But we were doing the very best we could with everything coming at us. We did make changes. During COVID, you could have ivermectin if that's what your physician wanted. We did.
All right, all true. I'm afraid I'm going to have to take
Sarah.
time away from
Yes,
candidates.
It is true.
Yes. That is true. It's actually in the report.
Candidates, please.
Okay.
Thank
There
you.
will be, we will
giving
have a
facts.
meet and greet after.
Okay,
for
how
you
about
to
that?
talk with the
All right,
candidates.
my flag's up. It's
Okay.
all yours.
Mrs. O'Neill.
Okay, medical freedom is total autonomy and freedom for the patient-doctor relationship. And I am including a doctor that has all alternative medicines for a patient and their relationship. That's why ivermectin was put in. And all kinds of, I know cancer patients. My first husband died of cancer at 40 years old, and I was a young mother. And I went to Jamaica. I went to different places to go find cures for this young Marine. So it's very important that we understand that patient relationship with their doctor. And they need to be able to go in and out of a hospital when their patients are in that hospital. There are concierge doctors that cannot go in those hospitals and see their own patients. I know that. I have people that do that. And also, the medical freedom to me is to keep the government out of our lives. That's it. We can do it. I know we can do it.
Okay, thank you. Question 6. If there is a conflict between federal and state issued public health recommendations, what role, if any, should SMH board members play in determining which recommendations to follow? Shall I repeat that? If there is a conflict, when there is a conflict between federal and state issued public health recommendations, what role, if any, should SMH board members play in determining which recommendations to follow? Okay. For question 6, Mrs. O'Neill.
Okay. The board has the right to do policy without the public knowledge. It's in the charter. I read it. I can read it to you. I've gone through this charter. And so my recommendation is, of course, your local community first, then your state. This is what you call local action. So we would have to look at what we can do locally. These charters are constitutions for you. These are our constitutions. The Sarasota County has a charter, which is a constitution. The hospital sits within that corporation as its own corporation. They have a constitution. So that's what I would do. First, go first into the local your charter, go into your local community. When a mandate comes down from the federal department, you need to be careful.
Thank you. Ms. Beitlich.
I am actually going to say that I'm not 100% sure how to answer that as my role on the hospital board. I don't disagree with what you've just said. However, I do know that we are there to support the Florida law. We are there to make sure we're following regulatory standards. So I'm not 100% sure how to answer that. How's that?
Thank you. Ms. Peruz.
Sorry, that way.
Yeah, I mean, that's a tricky one. I think, really, if we look at the COVID situation, yeah, we all know that everybody kind of got hit in the face with something no one knew how to handle. So, yes, 100% agreed that, that was, in the moment, we should have followed what we knew. But when we knew better, we should have changed direction. And by that, I mean that the public involvement should have been very important at that point. I think that there's, obviously peer review studies, things like that, but there's no time for that in the heat of the moment when a pandemic hits and things need to get made. I think what happened was we blanket approached what was done with COVID, and we followed guidelines coming from the top that now we're seeing they're being challenged at this point, and that's being nice to say that. Things changed. You had, keep 6 feet apart, put a mask on, all these mandates. I remember even just down in downtown Sarasota walking through open air restaurants having to put a mask on, things that just didn't make sense, we knew better. We should have changed at that point. and we should have addressed the government with sorry, I'm not going to say yes to this.
Thank you. Ms. Lodge?
Yeah, I think I want to go back to the question. The question was conflict between federal and state public health recommendations. How should the hospital play? I think our hospital has an excellent legal team that we have the privilege of being able to lean on in these situations. We also have an excellent medical executive committee that we also can lean on as a board to get informed information from that aspect. But a perfect example of this, and it goes into what was just being discussed in hush, we didn't mandate the vaccine. It was put out there that we were going to have to mandate the vaccine because the government said that if we don't have 100% vaccinated employees, they will not pay our Medicare bills. So we, as a board, we patiently waited for DeSantis to change that. And the minute he changed that, we changed that for employees. I want to make it very clear that we used the state form for that. It was if you did not want the vaccine, even if we were before DeSantis, you could fill out the form and put it in. You didn't have to give us an explanation. It was very clear to why you didn't need the vaccine. It was a simple signature, and we accepted it. So I think this is a great example of how the board stepped in and evaluated what was important to our community, what was important to our employees, and what was important to everybody involved.
Thank you.
I got the red card.
Mr. Peters?
So we're a county hospital, and so we follow county statutes. And one example is when I was teaching at State College, I took my clinical students into Sarasota Memorial as a clinical instructor. I was only allowed to take 12 students in at a time. That's one of the statutes that we follow, amongst others, for the county. We deliver and administer medication. That's FDA. And so when you're talking about the different governments and how they run our health care, not only at Sarasota Memorial, but all over the country and the world. And so there are certain rules you follow. I'm a sub-investigator in clinical research in my private practice, cardiology practice I work with. I have to follow the FDA rules. I have to follow the rules that are set for inclusion and exclusion on patients. And that's just the way it is, to keep you safe. To keep you safe. And I agree with Pam. The federal government said any business with 100 or more employees would have to be vaccinated, and we prevented that. Thank God we did. And I'm waiting for the red card. So here we go.
Thank you, Mr. Cooper.
Yeah, so I think it's two parts. One, yeah, the hospital has an attorney, and you look to the attorney and say, well, what is the prevailing law, and what keeps us open and available to provide the best quality healthcare outcomes for our citizens? That's the first question you need to ask and understand how those things work. I'm not an attorney. I don't know how to answer those questions, but we want to do what we want to do within the confines of the law. Some of the challenges that I think are raised up here is 70% of the hospital's revenue comes from Medicare and Medicaid. And if the federal government, and I don't know how many of you are on Medicare or Medicaid, but if the federal government says if you do not follow the federally regulated guidelines, we are not going to pay those bills, the hospital shuts down tomorrow. And during the pandemic, and I know this is kind of anchored here, babies were still being born, strokes were happening, heart attacks were happening, broken bones were happening. There were real healthcare emergencies that were happening outside of this. And so if we were faced with a decision of whether or not we wanted to provide the best quality healthcare outcomes for our citizens, and if it was a law we didn't agree with, that's a real difficult position to be in. But the question I would have is, how do we stay open and make sure we're providing the best quality healthcare outcomes for our citizenry? Because it wasn't just a one-issue healthcare system. I mean, we had kids being born. I mean, I had surgery during that time, and so there was a lot of things that were going on well outside of this that we want to keep doing and providing for that the federal government may regulate. Now, whether you personally agree with that or not, as a hospital board member, your duty is to the citizenry. You want to make sure you're providing the best quality healthcare outcomes for them.
Thank you. Question 7. In your view, what is the role of government-funded public health initiatives in our community? What is the role of government-funded public health initiatives in our community? And this is question 7. Mr. Cooper.
Can you give an example? Like what do you mean?
When the government has a public health program,
Like what?
Ruth, help me out.
Abortion.
We don't have much public health. That's the problem. Public health is what is not done to an individual, but it's like education, medical education, preventive care. Those things would be public health. And
No, that's not.
Vaccinations, clinics, does that make sense, Kevin?
It doesn't.
I don't
Repeat the
think it-
question.
no.
You know what? If it doesn't, we don't have time to mess with it. Let's go right on.
That's a tough one.
I agree.
Question 8.
That's a tough one.
Keep going.
It's another one that's out of here. Okay, it's out of here. It's gone. Okay. Question 8. The Herald Tribune has reported threats of violence against hospital board members and staff. Do you perceive these threats as a problem? And if so, what actions would you recommend to reduce threats of violence? The Herald Tribune has reported threats of violence against hospital board members and staff. Do you perceive these threats as a problem? And if so, what actions would you recommend to reduce threats of violence? And this is question 7? 8. Thank you.
It's me.
Okay.
That's me. Well, it's not good. Public threats are awful. I mean, my family has had threats against their lives. I live this. General Flynn, we lived this. So it's a serious thing. Very serious. No board, no person should have a threat against their life. Very serious. I mean, I would take extreme caution and extreme, no matter what they think or their opinion is, you have to get, prepared for any, it's like in active shooter. We did active shooter training. You have to be prepared for threats, okay? Threats can come from anywhere. And by the way, there's a lot of mental illness. There's a lot of different types of people that just, cause havoc these days. There's a lot of this going around. So it's a very high priority for me. The hospital is a high priority. That is a place that it could be a threat. And anybody in there working or on the board or anything is high priority.
Thank you. Ms. Beitlich.
Yes, it's an interesting question. I do want to make one comment back to something said earlier. One of the things you need to know about SMH is some of the things that we could make decisions on immediately. For example, it had first come down, speaking of the 4,500 babies born during COVID, that you couldn't even have the father in there with the laboring mother. I walked down to David's office, David Verinder, and said, just so you know, as long as I'm here, the executive director, the dad will be in the room with the mom. You good with that? He said, absolutely. The point being, we make as many decisions as we possibly can for the patient. As far as threats against a board member, I think that we live in a world where you can have a threat against anyone at any time. I mean, you can walk into a grocery store and not know if they're, like you said, is an active shooter. I think the board did go through a very tumultuous time. There were threats. There were really scary things that happened. I think the board did its due diligence, had our public safety officers there at the board meetings, literally asked people to go through the security, winding. You're almost going through an airport. I think you always have to do that. Would that stop me from still running for this office? Absolutely not. Absolutely not.
Thank you. Ms. Peruz.
Yeah, I definitely think that any threat against any person or board should be taken highly seriously. I think it should be addressed. I don't think that, I will say that, like Mary, like General Flynn, opening the clinic myself have had a lot of personal threats. I've had people hiding out in the bushes. I've had people sitting out in their car. I've had emails sent to me. So it is a very scary thing, and I take that very seriously. That's why I love our Second Amendment so much, because we are all protected at the clinic, just in case. But yeah, no, all jokes aside, that is a very serious thing, and I think that the hospital should pay attention to threats as well.
Thank you. Ms. Lodge?
Yeah, it's a tough question because I've experienced it firsthand. You know, we are wand. We have a security that uses the wand. Within the last 6 months, one of our board members sitting at this table was followed. A year and a half ago, I was followed into the elevator. We've had TikTok videos made of us that are disgusting by somebody sitting in this room. It's really sad. We've lost a doctor who had death threats, and he said, this isn't worth it. Why would he practice medicine here? So it is something this board does not take lightly, and we are doing everything we are for your community, but this is an unpaid job. And so people ask me all the time, why do you keep going? Because I care passionately about this community, and it's really important, but I do not think it's okay, and I do not condone it. I think it's wrong that people think that violence is okay.
Thank you. Mr. Cooper?
Yeah, I haven't seen any of them directly, but if what is being said is true, it's embarrassing, particularly if it's coming within our own community. I know during the peak of these things, there's people busing in, out of town people to speak and cause disruptions at a lot of different meetings in this town. And if that's coming from out of town, I mean, it should be embarrassing anyway. But if it's from our community, it's from Sarasota, people should be embarrassed. Now, you know, I've had mortars fall in my position, I've had rockets shot in my face, so, you know, I know what it's like to have your life threatened and stand up afterwards and dust yourself off and move forward. But for something that within what is really the foundation, the bedrock of American democracy, is that reasonable minds can disagree. And that's what it's about, and that's what forums like this are about. It's bringing together different ideas, and what we try to do is come together to provide the best outcomes for America. And so we're gonna have those disagreements, but it's just beyond the pale to think that anything would come to violence because of it. It's I would be mortified, not just for looking at my family and looking at my friends to know what's happening, but for as a community, that's what it would come to when we have a disagreement, that it becomes of violent threats, whether it's threats of a life or threats of physical violence. It's just, it's just embarrassing.
Thank you. And finally, Mr. Peters.
Yeah. So I practice my life and my career and my role on the board with dignity, with respect for others, with quality for all, and with civility. And I sure wish everybody would think that too, and live their lives accordingly, but they don't. And we, you know, was mentioned that it's a travesty to have us board members threatened. We're here for you. We are here for you. We're taking care of the health care in this community, and we're following our good quality and dignity and respect for you as our community. And it's terrible to have your life threatened. It shouldn't be. I felt very bad for the people. I myself was followed to my car one day. You don't know what's going to happen to you. You don't know what's going to happen when you get to your car and what they're going to do. We're transparent. Everybody knows where we live, what we do. We're going to be at the board meeting at a certain time. It's not fair to us. It really isn't. We're here for you. And there's the yellow card.
Okay.
I could go
All
on
right.
and on.
Thanks. We're drawing to a close, so this will be the final question, and it's an open-ended question. For this final question, the candidates can make any concluding remarks that they choose to make for a minute and a half. So you have a minute and a half to tell the audience anything that you feel they should know before they leave tonight. And also, there will be a meet and greet after the debate and the forum, and we'll talk about that in just a moment. Okay? So I'm going to follow the protocol that Mr. Cooper, since we skipped that question, will go first.
sure.
And if you would make your concluding remarks.
Yeah, so I said at the outset, I've been serving this community since I joined the military at 18. And when I moved here 16 years ago, I've done nothing but devote my personal and professional life to community service. And serving on a board is a craft, and understanding how to manage a 1.8, almost $2 billion business a year is a craft. And the business of the board is the business of the hospital. It's not the practice of medicine. And I don't think we do a good job of recruiting the best and brightest medical minds from around the world when we say, come here and we'll tell you how to do medicine. And I think it's really important that we continue to do that and continue to grow what we have here, because there are a few necessary conditions for community success, and quality healthcare outcomes is one of them. You can talk about education and public safety as other ones, but if we don't get this right, we're not going to continue to grow as a community and continue to be the place that everyone has grown up in and come to as the place they want to be in. And so I'm dedicated to that, and my hope is that one day my babies will have their babies at Sarasota Memorial Hospital the way I was able to.
Thank you. Mr. Peters.
So, as I said before, I'm not a politician. I'm a healthcare provider. I'm an educator. I'm a nurse practitioner. I'm a retired major, and all I've ever cared about all my life is taking care of people. And I started taking care of people way back in high school when I earned my LPN, and kept going on with more degrees for the RN, the nurse practitioner, and so on. And so you're in my heart and soul, and you always will be. And I try my best to take care of my people, because you deserve it. You deserve people with expertise. And I've learned, I'm a critical thinker, I'm a problem solver, and it's because I've earned that over the years in my experience working the OR, working the surgical ICU, trauma, open hearts, kidney transplants. I know what people need, and I know what their families need. And that's why I'm on the board at Sarasota Memorial. And I'm here for you. I speak your language, and I speak their language. And together, with your vote for me, we'll continue on for another 4 years of success and your good health care and taking care of you.
Thank you. Ms. Beitlich.
Yes. I would just conclude with saying that I feel I have the, as I said, education, background, experience. I know how to run a service line, if you will, in a hospital. There are a couple people in this room that have worked with me pretty closely. One of the biggest things I try to do is collaborate and get to the best decision for the patient. We always ask that question. What's the best thing for the patient? I have no hidden agenda. I don't have anything that I want to do. I'm not a politician, as Sharon said. I'm just there to make sure you still have the health care that you have in this community. I really wish I could implore upon you the gem that we have with Sarasota Memorial, the healthcare system. I've been in hundreds of hospitals, met hundreds of CEOs. You have no idea how fortunate we are to have what we do. And I'm really here just to tell you, I'm here to preserve what you have. I'm here to preserve us moving into South County, continuing to grow what we have, and keep the very best healthcare providers that we have here. Again, I hope you'll vote for me, Pam Beitlich with the B, at-large seat number 3. Thank you.
Thank you. Mrs. O'Neill.
I'm running for the hospital board because I'm looking, like I said, from the 60-yard viewpoint, because our future is very up in the air right now. We have to have different abilities to look into the future, what's going on in this country. I know the Constitution well. That's what I live, breathe, and eat. I am very concerned about the hospitals with what Obamacare has done, and data and digital currency. Everything will be in one mainstream database. We will not have freedom like you think. So I'm very concerned about this hospital, especially for children and the elderly. Children are going to be very, very important to protect. Now I want to read something to you because it's very important that you know this. The SMH board has a blank check to purchase anything deemed necessary for health care with zero public input. That's in the charter. Here's another one. SMH spending without board oversight nor any chance of public input. That's in the charter. One more I'm going to read to you. SMH has a carte blanche to purchase and obligate county taxpayers to huge debt with zero input. One more.
Mrs. O'Neill, I'm going to cut you off. Thank you. Miss Lodge.
Yes. Hard to follow that. So I'm running for re-election because, as I've stated several times, I care passionately about this. I have been involved already, and I have the understanding to the complexities of this hospital system and what it needs in order to continue to be the excellent provider of healthcare that you have grown to love and adore. And I want to continue that for our community. As Kevin said, I've got 3 kids. I hope my kids stay here. I hope they have their grandbabies here so I can hang out with them because I love kids. Pediatrics is very important to me. Elder population it's going to double so by 2035. So it's very important to this board, and I'm here to help that move forward. So I ask that you re-elect me on August 20th, Sarah Lodge, Central District 1, but it is a countywide vote, so all of you can vote for any of us. So.
Thank you. And last, Ms. Peruse.
All right, so I'll close us out. So I think, unfortunately the hospital board is partisan. So we have to choose between Republican and Democrat, which I think is unfortunate because I think that's a big problem that medicine has been highly politicized. So I just want to assure everybody, no matter what, I will be there to support anybody that comes before the board. I don't care what political side. All I care about is the health and safety of every patient that comes into SMH. That is my #1 priority. I've always said it, and I think I've shown it through and through in everything I've done. It does not matter to me. I do hope that you vote for me on August 20th. I think that I wouldn't be here running for office if the hospital didn't need change. I would not be doing this. I'm not a politician, and this is way out of my comfort zone. But I am willing to do what's necessary to make sure that we do have change. I think that our nurses need some change in the hospital. I think they're begging for it. I think doctors need the change, and I think it needs to be a more comforting environment for everybody. So thank you very much. Tanya Paris, August 20th, vote for me.
Wonderful. Okay, that concludes the formal part. That concludes the formal part of the forum. Candidates will now stand by a sign with their name. There may have been questions that you didn't get to ask, or that you'd like to ask the candidates.
Go ahead.
So we'll have a short meet and greet now, and the candidates will stand by their name. Okay. I think that was very informative. That's what I pulled up to try and read.